is a special report.
And how we have to keep the faith because we're all doing something together that is so important at this moment, and it really depends on all of us. New Yorkers have really been stepping up, and even though sometimes it's hard to see, it's hard to feel, we are making some real progress. It's because of all of you. It's because of the hard work you're doing with social distancing, with shelter in place. It's because of the changes you've had to make in your life, but you've done it. And you've done it really, really well under very tough circumstances and very fast changes in your life. So faith is when we believe we can get somewhere, we can get somewhere together. And I want people's faith to be rewarded. I want you to see the fruits of your labors. And today, in a moment, we're going to unveil some really important new information that gives you a sense of how things are progressing and how it directly relates back to what you have been doing, the hard work you've been doing, all of us have been doing. But I want to put it this way. We are now one big team, New York City, all of us, 8.6 million people, all together, one cause, one destiny, we're one team. And when you think about it, this is the most important team you will ever be a part of. Fighting the coronavirus, the greatest healthcare crisis in a century, the greatest crisis of any kind in our lifetimes. We all together need to fight this. So every single one of us is on the same team here. There will never be a moment that's more important to act as a team, to believe that together we can be greater than the sum of the parts. New Yorkers are proving that right now, and I want to thank you for that. And so, as I said, it's important to show you that what you're doing, every single one of you, affects the information I'm about to show you, because every time you practice shelter in place, every time you practice social distancing, you're reducing the spread of this disease, and you're saving lives, you're protecting people, you're reducing the number of people who end up in the hospital, the number of people who end up fighting for their lives in the ICU. You're reducing the number of people who test positive. Your actions will be reflected every single day in the information we provide, and we'll all watch it together and act on it together. So let's go to this new information now and talk through what it means. I talked about it last Thursday when I said we're going to go through phases here. Right now we're in the widespread transmission phase, the one we don't want to be in, where the coronavirus is deep-seated in our communities. We want to end this phase. We want to move forward, but to do that, we have to keep doing the hard work, the shelter in place, the social distancing. We have to keep earning our way out of this. None of us asked for this horrible disease. None of us deserve it. But we still have to fight our way out, earn our way out of it through our actions. So that means staying focused, staying buckled down on the rules that actually work, and continuing to stick to them. No matter what's going on around us, this is the way forward. Now, 3 indicators I said we would roll out today, and you can see them live right now at nyc.gov/coronavirus. I'm going to go over them, but again, this will be information that's always available to you, updated daily, and we'll all watch the progress together. And I want to note right there, I want it to be steady progress. We all want it to be steady progress. It may not always be steady progress, stating the obvious. Sometimes the numbers may go up, sometimes down. We want it to be down a lot, but we can't guarantee every day is going to be perfect. Sometimes one will go up, another one will go down. We got to see them all move down in unison over a prolonged period of time to be able to get to that next phase where we have low-level transmission and we can start on the path to a more normal life. So let's go over these indicators. Number 1 is the daily number of people admitted to hospitals in New York City for suspected COVID-19 conditions. So again, we're going to show you the progression from day to day. And the data I should tell you up front is typically about 48 hours lag between when the information that we're talking about, when the actual admissions to the hospital or the ICU, et cetera, when it happens and when it's reported. And that is because different hospitals report at different times in different ways, and our health department has to get all the data collected and consistent before it's published. So there will be a lag. We're always going to see if we can reduce it, but for now, assume about a 48-hour difference. But it's still going to tell us what we need to know. So for April 11th, that is Saturday, you have 383 people admitted, new hospital admissions for suspected COVID-19. The day before, that was 463 people. So that's a really meaningful improvement. That's a step in the right direction. The second number, daily number of people in the ICUs across our health and hospitals, that's 11 hospitals, public hospitals, the number of people in the ICUs for suspected COVID-19. So again, going back to April 10th, 857. By April 11th, Saturday, 835. Also moving in the right direction. And then the third indicator, the percentage of people who tested positive for COVID-19. So again, that number, going back to April 10th, 59.3% citywide. By April 11th, 58.1%, moving in the right direction. And then a very specific subset of that, the tests done by our public health lab, and they focus those tests specifically on a certain type of case, and Commissioner, Deputy Commissioner can go over that in detail in a moment. There we see the public health lab testing, again, the same good pattern. April 10th, 80.5% of those tests were coming back positive. By April 11th, 78.4%. So day one of this new effort, I'm pleased to report we do see all the indicators moving in the right direction, moving downward together. This is a very good day. This is day one. Now we got to keep working all together to keep these numbers moving in the right direction. And I want everyone to take it personally. I want you to feel like when you see these numbers are abstractions, but they represent human beings, and they represent the future of the city and what our lives are going to be like. When you see these numbers, take it personally. Recognize this represents the progress that you have achieved, but we've got a lot more to do to keep that progress going, to get to the point where we might be able to ease some of the restrictions and move towards normalcy and have a low transmission dynamic with COVID-19. And I always will keep saying, if we don't get it right, or God forbid this disease resurges, we're going to have to potentially tighten restrictions further. So we don't want that to happen, obviously. Best way to avoid that is to stick with what's working and keep our discipline, and New Yorkers have been absolutely outstanding. So the next topic I want to talk about, this is the question of how we make sure that we address everything we're seeing in this crisis. This crisis has had so many negative effects on so many New Yorkers. But more and more we're finding out just how much there's been a painful disparity. So many people have suffered across all communities. Some communities have suffered very particularly in a disproportionate manner. Now, we know we will get through this. We know this is a crisis that will end at some point. But the disparities that we have now uncovered are deeply, deeply troubling. They reflect historic disparities, and they remind us that we must do something different going forward if we're going to stop these disparities. We can't just see it and consider it something that's unmovable or something we have to live with. We should never live with these kind of disparities. We should fight in every way we can today and in the future to end these disparities. Right now, we have a lot of work to do to address the needs of communities of color right this minute. And what I announced when we put forward the information proving the disparities was a 4-point plan. And I'm going to talk today in more detail about 2 parts of that plan. There will be more announced going forward over the coming days, but I want to start to fill in the information as we have it for everyone. So one of the key pieces of that plan was a really large-scale media campaign to educate people about the coronavirus, to help them know what they can and should do to protect themselves and their families and all of us. And we had an original campaign that we launched in the middle of March as we were seeing the first deaths from this horrible disease. We launched an $8 million media campaign, TV, radio, digital ads in 15 languages, subway ads in English, Spanish, and Chinese, print ads in 15 languages, $1.5 million of ads that were put in community and ethnic media that are so important in this city and trusted in so many communities. We put that out there to try and really get people a lot of information that a lot of people weren't getting from other sources, to start clarifying what was going on with the coronavirus and how people could respond. We launched an advisory committee of 80 community-based organizations, every kind of New Yorker of all 5 boroughs, to help us make sure we were doing the right message, the right outreach. And we did outreach in other forums, on WhatsApp, on WeChat, on Kakao Talk, which is Korean-focused. So we used a lot of methodologies, but what we're announcing today is a new campaign. And this one is laser focused on the communities that have been hardest hit and where the disparities are greatest. This is going to be a $10 million advertising campaign to not only get the information out again, but to get it out in a deeper way, meaning to focus in a very pinpoint manner on where the need is greatest. So we've targeted 88 zip codes in New York City where we see the most disproportionate negative impact of the coronavirus. That's where the focus will be, to get this information out, to make sure that some of the confusion that everyone's feeling about coronavirus is addressed head on, that some of the myths and misunderstandings are addressed, that people are given more information about what they can do or where they can turn if they need help, and to do it in the languages that so many New Yorkers speak. So again, a $10 million campaign, 88 high-impact, high-need zip codes will be focused on. TV, radio, and digital in 15 languages, but beyond that now, direct mail pieces to homes, giving people information that will go right to their doorstep in a very accessible format. So that's on the media side, but as I said a few days ago, traditional media and digital are very powerful, and we need to use them fully, but we also need to go to the grassroots, especially if we're going to reach communities that are not necessarily hearing all the messages and that need more help and reassurance. There are many communities that describes, but particularly immigrant communities, particularly communities that in recent years have felt very much that they were in danger and in many ways have receded in terms of how they connect with the rest of our community, pulled back out of fear. We've got to reach out in a really compassionate, open manner to communities that need a lot more information. And some of that has to be done on the front lines. Media alone can't do that. So we're going to be doing to targeted communities. We'll be doing robocalls. We'll be doing live calls from people who have the information, calling directly into households. We'll be doing a texting campaign. We'll make sure at places that people still are going, essential businesses, grocery stores, supermarkets, pharmacies, those grab-and-go meal locations, the 435 locations where people can get free food. We'll have information posted there. We're going to also work with community-based health clinics. And these are organizations that do such important work, and they know their communities, they speak the language, they know the culture. We want to bring them back into this work more deeply. A lot of them have been disrupted in recent weeks. We want to get them back in this. We'll have more to say on that in the coming days. And we want to see ultimately the restarting of the kind of grassroots outreach, literally people out in the community, educating, answering questions. But to do that, we have to keep our healthcare workers safe. We have to have healthcare workers who can move into that type of work and not just be needed at hospitals. And that has everything to do with those indicators I talked about earlier. And we need, of course, the protection for all of them, the PPEs. So a number of pieces have to come together, but our goal is to soon have that grassroots outreach moving to really make sure the information reaches communities deeply and widely, and people feel it, understand it, act on it. This is how we can help protect folks who are really bearing some of the brunt here. Now, speaking of bearing the brunt, I've said many times this is unfortunately not just a healthcare crisis, it's something worse. It is also the greatest economic crisis since the Great Depression. That's what we're seeing unfold right now. And for a lot of us, we used to hear those stories from our parents and grandparents and never thought we'd live through anything even slightly like it. Well, guess what? Very, very sadly, we are living through something like it. The number of people who have become unemployed just in the last few weeks is staggering and unbelievable. We're just still beginning to understand the magnitude of it. And the only parallel is the Great Depression, and the suddenness with which this happened in some ways was even worse than what happened 80 years ago. So we need to move aggressively, and I'm going to tell you always what the city is doing. There's a lot of things the state needs to do. There's a lot of things the federal government needs to do. The federal government did come along with the stimulus, and that was good because they were important pieces directly for working people. But we need so much more, and we need the next stimulus to happen quickly this month to keep getting support to working people, keep getting support to small businesses, and to the city and state governments that directly support everyday people and protect them. That has to happen. We need to do a lot of other things quickly to catch up with the totality of this crisis. So what's happened already? There's been a moratorium on evictions. That's a very good thing, and that continues. So, you know, what's basic and essential here? Having a roof over your head, even if your livelihood is gone. Well, no one can take your home away from you. There's a moratorium on those evictions to protect you. The 2 million plus New Yorkers who are rent stabilized, I've called upon the Rent Guidelines Board to act quickly to give all of you a rent freeze. It's something the Rent Guidelines Board has the power to do. It's something they have done before in times where the facts merited it. I think this is absolutely a time where it's 100% clear. People are hurting like never before. They deserve a rent freeze. I want to see that happen quickly. That will provide some relief for over 2 million New Yorkers in rent-stabilized housing. I've urged the state of New York to change the laws and rules to allow renters to use their security deposits to pay rent. There's no reason at this point, given how much dislocation has occurred, that a security deposit is sitting in a bank account, not helping anyone when it could be used to pay the rent, help the renter, help the landlord have money to pay their expenses. That is the kind of thing we need to do in the middle of a crisis, and I want to see the state act on that. We need to think about and act on some other pieces as well. So we're launching a tenant hotline for tenants in all 5 boroughs through 311, because a lot of tenants right now don't know what their rights are. They don't know how to navigate this. They're running out of money. They want to know where they can get relief. And remember, what we can help you with is all the different ways you can get income, making sure you get money from the stimulus, making sure you get unemployment insurance. If you qualify for food stamps, that's another way to put money in your pocket. We want to make sure that there's anything that people can get, they're getting it, and that your rights are being recognized. No landlord can attempt to evict you. No landlord can tell you you have to leave temporarily because you're sick. You have clear rights as tenants. We want to protect everyone. So we're setting up this hotline through 311 to make sure people can get those answers and that support. And if it raises to the point that someone needs a lawyer right away, through 311, we can get you free legal assistance and assign a lawyer if you need one to protect your rights. So that will be up and running immediately. And then 2 other things I think would be really crucial in this situation, given the magnitude of what people are experiencing. I'm urging the state of New York to take a very good thing, the moratorium on evictions, and extend it to 60 days after this crisis ends. So I'm very thankful that the state acted to protect renters, and I know to protect other folks to keep a roof over their head. But we need to make sure that that moratorium on evictions doesn't run out, and it doesn't run out prematurely. We need to see this crisis end and then give a grace period to people to protect them, so we don't have a horrible situation where we finally get out of the coronavirus crisis and then see a massive wave of evictions. We need a period of time to help people get things back together and to protect them and make sure they still have a home. So the state should act on that right away. And then it's also something I think the state of New York could do that would help everyone. Let tenants who lost their income defer their rent. So if a tenant can document that they lost their job, which I'm so sorry to say so many people can at this point, If you can document you lost your job and you don't have income, give tenants the ability to defer their rent payments and repay over the next 12 months on a payment plan. There's, I think, some clear ways to put this together that protect tenants and respect the rights of landlords and make sure that everyone is whole in the end. But we can't have a situation where folks just have no money and no way to pay, and they're living with that constant insecurity. Let's acknowledge the extent of this crisis and give our tenants a clear way forward. That's something I think the state should do as well, as quickly as possible. All right, let me move to a very different topic. And this one, again, one that we all care about, and one where I can at least give people a little bit of good news as we fight through this crisis together. As we've seen with alternate side parking, folks obviously want to know where we're going with this and want the security of knowing that they don't have to worry about moving their cars. I've always said the one thing I cared about was making sure we didn't end up in a situation where our neighborhoods weren't clean, especially in the middle of a health crisis. I'm happy to say we've been monitoring. Our sanitation department's been out there. The neighborhoods remain clean in a large measure because so few people are out and about the way they normally are. So we actually see a level of cleanliness that is the right one for our city. And therefore, I'm announcing we are suspending alternate side parking for another 2 weeks. And this will take us till Tuesday, April 28th. So we're going to continue to update you, but right now, rest assured, no alternate side parking until Tuesday, April 28th. We'll update you again as we get close to that. And to the maximum extent possible, we can give people this relief. I want to do it. Okay, now, going back to where I started with how we are making the progress we're making. Look, every single person is a part of this, as I said, and it's not just what you do. What you're doing is working. People are practicing social distancing, they're practicing shelter in place. And, you know, we've sent out a lot of enforcement agents. We've sent out the NYPD, and we've constantly followed up on any concerns, and we're seeing really pretty amazing levels of compliance by New Yorkers. And sometimes when there's a report of a problem and the police show up or another department shows up, folks immediately fix the problem is what we're finding. And that's what we want. So the best way to make sure that everyone observes social distancing and continues to follow these rules for the good of all is to make sure you're doing it yourself. But if you see someone who's not, that I want you to think about that phrase we have used for years about protecting ourselves, in this case from a different enemy, when we say, if you see something, say something. In this instance, I want you to see that you can make a real impact. If someone's not doing the right thing, or if a line is developed that's packed too tight together, if a store is too crowded, if people are gathering someplace they shouldn't be, not practicing social distancing, please let us know right away. This is about saving lives. No one should hesitate. This is about saving lives. Every time we practice these rules, it helps us forward. So you can call 311 at any moment, tell them exactly what you're seeing, where it is, what time you saw it, and we'll send out the NYPD and the other agencies to enforce and fix the situation. And another option is you can go on nyc.gov/coronavirus. And you can just quickly put down just a little bit of information, and that will instantly register so all of our enforcement agencies can get on it right away. And in the next few days, we're going to add another option where you can just submit a photo on the 311 app or the 311 website and just indicate, you know, the location. And just by the virtue of having that photo and knowing what time it was and the location, the NYPD and all our other agencies will be able to act quickly to address the condition. We want to make it easy. We want to make it fast. We want to make sure the enforcement is fast. Everyone has a role to play in this, and we need everyone to help us. You are the eyes and ears. It's your city. It's your fight against the coronavirus. We're all in this together. Letting us know if you see a problem is one of the best ways to contribute to getting us out of this really, really tough phase and on to a better future. So I'll conclude, and then I'll just say a quick few words in Spanish, and we'll turn to our colleagues in the media. But I'll conclude on this important point about being a team. a lot of us are feeling right now the absence of sports. So many New Yorkers, we love our teams, we love team sports, we love playing team sports. I'm missing it all the time. I bet a lot of you are missing it all the time. We're not getting to watch the teams we love. But in fact, we are now part of a team. As I said in the beginning, this is the most important team you will ever be a part of in your whole life, right now. And we watch sports, and we have heroes who play on teams that we love, and they do amazing things, and they show strength, and they show resilience, and they do things we thought couldn't be done, and we love them for it. Well, guess what? That's you now. You are actually in the middle of such an extraordinary fight. You get to do the things that you have admired in other people. You get to be the player on the field who makes a difference, who does the extraordinary, who does what people thought couldn't be done. So this is where we are now, all 8.6 million of us on one team. And people have been acting like they're on one team and have been making a huge difference. And we see it already. Those three key indicators, we're all of us going to be able to watch them together. We're all going to be able to talk about what it means. But you saw even on day one that what you've been doing has had an impact. What you've been doing is working. We're going to keep watching them together to get us through to the next phase. So everyone, right now in our time, we've been shown a challenge we could never have imagined. But you have been doing everything that we need you to do to win. This is a battle. This is something we've never seen before, but together we can overcome it. And instead of just saying, here's some vague ideas, we're going to show you the facts that prove we can overcome it and prove what it means for you to be in this game and fighting hard and fighting to win. So thank you for being a team and acting like a team. It's making a huge difference. Just a few words in Spanish.
This has been a special report.